Ladies and gentlemen, welcome to the MedTech Impact Podcast, where you get to hear from leaders and innovators who are shaping the future of medical technology. I'm Kyle Cruz.
And I'm Richard Meiklejohn.
And we're your hosts of the show.
So today on the MedTech Impact Podcast, we're delighted to be joined by Bimal Maharjan, CEO and founder of GutSphere. Bimal, welcome to the show.
Hey, I'm glad to be here.
Hey, well, we're glad to have you. We were recently acquainted with you being part of the last M2D2 Impact program where you were a mentor. We got to know you well, and we're very grateful for your help and support for medtech startups and innovators. And of course, we're here to discuss, what you're doing in that space now with your own startup. Before we do get into that, though, we do like to set the stage and talk about the problem. And for you, it's a personal level, which we often find with founders. And, you call it your ikigai. And so, please tell the audience a little bit more about the problem that you're looking to solve.
Sure. I can divide it in two parts, one my personal story and my problem part. The first part, I say GI is my ikigai. The reason I say that is I didn't choose GI, the GI chose me. And it started really early on in my life. When I was 9 months old, I was declared dead in hospital because of GI complication. And thanks to my mom that she refused to believe that I was dead. So it was in government hospital in Nepal. So in the morning, doctors round, they came to visit bed by bed. And I was on one of the beds, and my mom was gone to purchase a saline water for me. And when she came back, I was covered in white cover sheet. And she was perplexed. What happened? She left me sleeping, but when she came back, a white cover sheet was covered me, and I was declared dead. And that was the horrific, experience for her. But she is very strong, and she refused to believe her son was dead because she still left me sleeping. And she asked the neighboring, caregiver what happened. And the doctors came around, and it was declared dead. But she had the intuition to put her ear on my heart, and she believes that she found a fair heartbeat. And then she roared like a mount bear, brought back all the doctors, and doctors did everything possible to revive me. Fortunately, I was revived. And since then, I grew up with upset tummy all the time. Bathroom was my best friend, and my friends, relatives, everybody teased me. But fortunately, after teenage years, it went away for a bit. But it came back, and previously it used to be very upset tummy, diarrhea, and so on. But it came back in 2016 when I moved to the US. It came back in the form of chronic constipation. And then I went through the US healthcare system. Unfortunately, I was deeply disappointed by it. It was particularly through my colonoscopy experience, post-colonoscopy experience. I was so angered by the journey I went through. I thought about doing something about it, but I didn't know what it was. So the first step, I wrote a book about it. Wrote a book about living constipation free, because by that time, but it was 2020, I had self-experiment myself. I had read ton of book, all the research papers that I could keep my hands on, all the books I could have had hands on, and then I really became the scientist of my own body and was living constipation free. And that post-colon experience, in which I lost about 15 pounds in about 2 weeks, or 10 pounds in a week. And I was really, really lean and thin, lean then 145 pounds, came down to 128 pounds. And it took me 2 years to regain that weight. And that angered me a lot, and wrote a book about it. And while I was reading a book about it, so this is where we can segue into the problem space first, right? So while I was trying to get better and recover from it, there are many things you go do as a patient. Number one thing is, obviously, when something happens to you, why is this happening to me? That's number one. Right? Number two is, where can I get information about it? Number three is, what can I do about it? Number four is, okay, who doctor I can talk to. Number five is, okay, do I need some testing, some procedures done? If there is testing and procedure needs to be done, it's about, okay, where kind of find the best doctor at the cheapest possible cost. And I didn't find any of one holistic solution. Then what I started doing was obviously spend thousands of hours educating myself. And while I told you about self-experimenting, right? Even to give examples about trackers, such as bowel movement trackers, the diet trackers, and so on, what I needed was to be a more holistic one, but I only find point solutions of it. And all of these crystallized to me when I was writing a book, My Living Constipation Free. And I borrowed this idea from another great author called James Nestor, who wrote a great book called Breath, and where he writes, every patient should be a pilot of their own health, right? And that's what I exactly did to live constipation free. And at the epilogue of my book, that dawned on me was what we really need is a co-pilot who guides you, who gives you information, who helps you navigate entire through this. And that was particularly missing because that co-pilot needs to be with the patient all the time. It, it needs to be a continuous care, continuous information. It's not the you know, intermittent or reductive information that we get. We truly need a co-pilot. And then it went a multi-year journey for me to find the right form factor because technology needs to be right feasible and so on. So in short, it's my ikigai because I didn't choose GI chose me. And then all the things I have done in my life about the startups, so AI and my software engineering and this US healthcare experience and being a nerd to become scientist of one body, leading to building this copilot.
Okay,
GutSphere.
so I mean, truly incredible. There's a lot to unpack in there. Again, that personal story you touched on, power to all moms out there and the power of love and their attitude and the fact you're here today and what you've been through. And I think again, the fact that you're here to talk today about this condition, but obviously you have this personal story which you were touching upon there, is so impactful, so powerful. And again, it's the reason that a lot of great startups or founders, come about is because of that grounding, that foundation. So maybe you can tell the audience now a little bit more about the conditions. What is it from a medical aspect that is faced by people? What are some of the numbers involved?
Sure. I think when you talk about gastrointestinal health, here are the few diseases you will hear most often, right? Let's go from top to the bottom, right? From the mouth or from the esophagus, from the stomach. From the stomach side, you'll hear a lot of gastritis. You'll hear a lot of GERD or acid reflux. And when you go down to small intestine, you'll hear about small intestinal bowel overgrowth. It's called SIBO. And when you go down below, you'll hear a lot about constipations, diarrhea, or and what you'll also hear a lot about is irritable bowel syndrome, and which is there isn't one particular root cause for that, and we'll hear a lot these days a lot about the IBD as well, like IBD, and these days you'll also hear about more like colorectal cancer, right? And you will surprise as much as I was surprised when I read a research paper that up to 40% of the world population suffer from functional digestive diseases or gastrointestinal diseases. So IBS alone is 15% of the world population, and women are twice more likely to get it. The IBS, 15% of the world population, got about some 20% of it, and chronic constipation, occasional constipation, about 40% of it. The numbers are massive, and when you say that, okay, numbers are so massive, why don't we hear this often? Why don't this hear this often? And I feel like there are multiple reasons of it. Number one reason is on the patient side, it's 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 kind of embarrassing or kind of shameful to talk about that. People become shy to talk about that. For example, you talk about your bowel movements, right? You talk about the burping, farting, right? So all of these are big no-nos in most of the cultures, and they're deeply embarrassed by it. embarrassed by it. That's number one reason. And number two reason I think is, for good or bad, it's not fatal, right? So severity is that, okay, it's not that fatal immediately. Therefore, when you go to, even you talk to the clinicians as well, some ways you have some kind of bloating, it's okay, that'll go away. You have some kind of discomfort while doing bowel movement, it's just kind of go away. It's kind of, there is a bit of minimizing of that problem. And that's another reason why it's not mostly talked about. I genuinely believe that, because it's not fatal. But third thing is, of even the patients, right? I think when it's your anchoring point for your discomforts keep on changing. Initially, when you have a little bit of discomfort, you get a little alarmed by it. But when you learn to live with that discomfort, which is not all right at all, your anchoring point for your when to seek the medical care keeps on rising. And that's another reason why you don't hear about it. So therefore, at GutSphere, what we want to say is, we want to actually, you know, uh, remove that embarrassment to talk about this bowel movements or the gut health or upset that we talk about. If we can talk about sleep steps, heart rate variability, and so on to as a health indicator, we truly also believe that we also need to talk about our gastrointestinal health, bowel movements, and so on, because that are also extremely important health indicators of it.
Absolutely. I mean, so well said. And Kyle, it's funny because we were talking about this before we came on, and one of the conditions you didn't mention to me is a very popular one now, celiac disease, and I think that just sums up how commonly spoken about that one is, but maybe less so the other ones that you mentioned. But it is, I think, a growing trend that you're really seeing, that you're tapping into here, about how people do want to know more and better understand, Kyle. And again, we were speaking about this before we came online, and I know that it's something you've been looking into yourself.
Oh yeah, absolutely. Well, it's kind of interesting, right? Because I think hearing Bimal's story, which is just, I mean, incredible. I mean, it's just a beautiful thing that here you are today, right? Using your life experience is something we hear a lot about. Yeah, but I think about kind of just this whole gut health in general, right? I mean, we were talking about this before we got on the show. I mean, there's so many illnesses, diseases that come from having poor gut health. And I think it's really kind of interesting too, because I was mentioning that, hey, I'm seeing more and more products being marketed to consumers now to help with gut health challenges, because there are so many, right? So much stems from the importance of gut health. And I didn't even realize this. And I'm seeing this mushroom coffee, right? I'm reading books here that I have in the back, all about gut health by Dr. Austin Chang there, who's chief medical officer for Medtronic in their GI division. And I'm just, fascinated by the importance of gut health and how it can really keep you healthy in so many different aspects of life. So now here you are, Bimal, right? And you've started GutSphere. Okay, so I'm really curious, tell us more about GutSphere, how it's helping everyday people and patients that have gone through your types of experiences and that struggle with finding the right solution and treatment to help them improve their gut health. How is your solution helping them?
That's a great question. Thanks for asking. And I am the patient number one here who is getting help. So to give a bigger background about how I came to envision about this product or platform. So as I told you before, I became the scientist of my own body. I started measuring it. What I started doing was, okay, reading a lot. That's number one. And number two is tracking all of this bowel movement, diet, my symptom, my sleep, because it's a very multifactorial, the external variables and so on. So I couldn't find any of the two tools out there right for me. So what I started doing was I created a Google form first, and then Google form was a bit, outdated. Then I went to Airtable form for this all the diet trackers. I went extensively and then started analyzing one beta. Then what I realized was not every person will have the resources or the know how to do that. So what about I need to create that trackers in the first place and education materials in the first place. So and at the end of it, I lived constipation free. So that's number one. The patient number one is me. I I had the education. I went to tracking. I analyzed all my data, and then went to the process of elimination about okay, because this is not one single factor. This is multiple factors that go into it. So to to list some of the factors, number one thing is obviously diet. Diet is number one factor, which you in the US, if you're eating standard American diet, which is highly processed food, which is very tasty by the way, and you get addicted to it. So
Yeah, no kidding.
so diet is number one. Another thing is hydration. Hydration is number two. Number three is sedentary lifestyle is number three. Number four is stress. And I went through this all the process of elimination. I started remembering one by one. So one thing with I realized was for me when I was the had chronic, the pizza was poison for me. And why pizza was poison for me? The reason why pizza was poison for me, especially in the US, was is the combination of two things that doesn't do well with my digestive system, and it could be different for every people. For me, the combination of the refined cheese and refined flour,
Hmm.
and it was just, I would tell like if I eat pizza two meal in a consecutive two meals, I would have hemorrhoids bleeding the day next day. So I was able to do that. So therefore, what I learning was okay, what are the trends, what patterns, what trigger points I was able to do that, but I couldn't find any of those tools out there. Yes, there were point solutions out there as bowel movement trackers, diet trackers, symptoms tracker, but independently. But what we truly need as a patient is something which multifactorial, helps combine track very conveniently. And third thing was about how to get trend analysis so that it can help to change the habit and lifestyle of it.
Hmm.
And coming down to your point about different supplements and so on, those are very important things as well. For but that can start to get very expensive. But how we can do, we start with the okay, what are available to you on a day-to-day basis that without burning a hole in your pocket, you can
Yeah.
actually live healthier. So I'm the patient number one, and which I did to myself. It wasn't available to anyone else. So can I provide that? And actually, I uh, we are not public yet, and we will go to be public sooner. And we are going to start with and again, another challenge is current technical was, so if you think about tracking any health metrics, you can divide into basically two types of track, right? One is very active, another is passive. So passive meaning, so if you wear let's say iWatch, then tracks your sleep and also on, you don't have to do think about it, this passive tracking. But active tracking is about oh, you need to input your own data, the diet trackers, right? For bowel trackers, it can't do passive, it has to active, you patient need to track that. But what are the challenges with that? So I told you about, there were point solutions, but there were not the holistic platforms. The reason why is, if you put all of these together, and I'm going to a product perspective here, in one particular app, it's going to be a current graphical user interface, is going to be a navigational nightmare. Because in the current software, how we consume software is through like navigation, there and there. And there are too many things like the cognitive overload is so high, the users keep up. That's number one, right? Users keep up. So that's the reason why the active tracking is so difficult, and adherence is so low. After a certain time, the friction is so high, just people give up. That's number one. Second thing is, uh, how to make this so convenient so that people can do that active tracking so much easier.
Hmm.
And this is where the generative AI, the platform shift comes in. Then I was looking for that, and when the chat GPT came out, it was my eureka moment for me. Now how we consume software is going to change. The way graphical user interface changed the way we consume software, similarly the large language model is going to change the way we consume software. Today, we hear a lot about it, technology, agents, co-pilots, and so on, which is more conversational. We want software to do things for us. We don't want to do things for the software, right?
Mm.
So therefore, in that scenario, with our hypothesis is if we can make this all the tracking very conversational, like talking to a friend, the friction of GUI goes away, the friction of navigational nightmare goes away, friction of remembering the pathways go away. It's having a conversation with someone, and that's the core belief that. And and what will that do? That what will that do is it will make this tracking accessible to everyone. That's number one. It will improve the adherence of it. And number third thing is many people who suffer from GI issues do not speak English, or many other, because it's a global problem. It has to be a global solution.
Mhm.
Therefore, just creating a software in simply in this one language is not going to be sufficient. But at the same time, scaling to all the languages in the current form factor of GUI, graphical user interface, is going to be very costly as well. That's one of the reason why developing a software in the GUI current format is difficult. Scaling is difficult, and I understand all the point solution developers out there why they choose to be that. But the game changes when there is a generative AI platform shift in which we can utilize a large language model, because the current agentic flows and current copilot, the consumption structure, and then we can actually uh, build that copilot for every patient.
So it sounds like, the active tracking side of, what patients are required to do. Sounds like GutSphere is, helping in that area, potentially. And I just think it's really interesting too, because I guess like the people that would probably leverage GutSphere today are folks that are obviously really struggling with some serious GI complications and health problems, and they can be anywhere in the world. And I mean, so it sounds like I'm just trying to kind of paint this picture for the audience here on how exactly your technology is used and leveraged by patients today. But it sounds like they would be, and correct me if I'm wrong, they would be the ones implementing, say, information on here's what I ate, here's how I'm feeling after I eat, here's, what's happening to me, blah, 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 and inputting a lot of data for, some sort of, what is there some sort of algorithm, machine learning that's processing this data and helping them identify, well, here, this is the problem, this is where you're struggling, and this is ultimately what you need to do to fix that problem.
Correct. So what I like to highlight again is the care journey. Earlier I told about, okay, first of all is the education. Why is this happening to me? What's happening to me? If I want to learn about IBS, how can I learn that in IBS in such a, micro learning of way? Even in the education, there are the challenge right now is if you go to doctor, you just either you go to the internet, you read a lot. You go to doctor, they'll hand up you a sheet of paper or you read a book. It's very, overloading at once. But what we're trying to do in the education part is also, can we do more micro education in a gamified way in the long run? Think about Duolingo language, right? You're learning a language, you're using Duolingo, it gamifies for you. It's a micro learning every day, so that it's become more manageable, 5-10 minutes. So in it, then you can learn more about a disease. That's number one. So you can learn about disease in a micro learning a way, in a more gamified way, so that, and that's the beauty of it, in a language proficiency that you you want to set at. That's number one. Number two is we are going to, that's education after is a lot of tracking. We're going to simplify tracking, all of the bowel movement tracker, diet tracker, so on. After that, what we will do is we will do a lot of like trend analysis. It's a multifactorial analysis about, and multifactorial analysis. Again, in that analysis, also there are three layers in there. One is frequently asked, like what are the trend and triggers. Another thing is a follow up to that, very let's say double click on that particular part. Another thing is a very rare question people need to ask. That's what the in previous in the current point solutions, it's difficult to ask your personalized questions to you, which is relevant for you. And beauty of generative AI, or what we are using AI, is that we can identify more personalized, personalized pinpoint personal causes for them. So that's the 3 layers of it. And after also is that when you talk about care journey, also is important to the clinical navigation journey as well. I don't know about you guys, but for me, every time I go visit a doctor, I all have a regret. The regret is that I should have asked that question. And that question always pops up post the visit, right? And then I have to wait for another meeting. But what if there is something like it prepares for you based on your history, based on your data? Okay, these are the questions that is present. And
Yeah.
even you go to your doctor or clinician, you have the data point to tell them. Otherwise, in the absence of data, what they are doing is trial and error, trial and
Hmm.
error. Even if
That's
they do trial and error, why, what can we do to, speed up the loop so that we present them the data? Therefore is a clinical navigation. And also in our journey, what we also testing and preparation. In terms of preparation, we talk about colonoscopy. I'll give you one very interesting statistics about two interesting statistics about colonoscopy, and my mind was blown away. There are 16 million colonoscopy per year in the US. That's number one. And second one is from there is a rescheduling of colonoscopy from 21% to 35% rescheduling of colonoscopy procedure alone. And because the reason behind is inadequate preparation. And the reason behind the inadequate preparation is the patients don't have right education at the right time to prepare for it, because you have to go to a very scheduled procedure, right? So that procedure preparation as well. And another part, two parts I want to talk about is sometimes talking to a patient who has gone through the same experiences as almost valuable as talking to a clinician. Therefore, you find therefore the community support, provide the community support. And I want to hit upon the supplements and the things you put about Kyle about. There's so many out there. What we also want to provide is, yeah, curated place. Okay, these are things that
Yeah.
you could try, you should do, and
Right.
it's more curated version of it so that it's simplified. So this is the journey I'm talking about. As a patient, what do I do? When do I do it? And you talked about severity of it. Obviously, severity of it. I also had to think about severity of it. I talk about care journey. Care meaning like calming the pain when the flare-ups are high. Second stage is avoiding the pain. And third stage is repairing your gut. And fourth stage is elevating the gut microbiome things. So I went through this entire care journey myself. Therefore, I'm able to crystallize, okay, these are the steps of it. And during the severity flare up, there is high motivation to avoid these, adopt these technologies. We have seen that because even myself also, when I had my symptoms flare up, oh, I need to start tracking. But when the symptoms die down, then like, okay, it's all right and go right.
Yeah.
But therefore it's the product itself. How do we build the product in such a way that there is a lot immediate gain for the patients, and also they be going to track for their in the care journey so that they can even elevate their gut microbiome in the long run. And we want to provide that entire end-to-end journey for the patient, and we will be the co-pilot and the patient will be the pilot. That's what we want to do.
So there's a lot in there again. I think like, you've spoken about this care journey, and I think this is so paramount to how we not just treat health, but how we prevent it in terms of treat health conditions, but how we prevent those conditions happening in the first place. And so clearly you have this approach where you're thinking about that care journey and you're thinking about educating, of course, but really providing a structured process where they can engage with their condition. And ideally, you can prevent it, but again, if not, you can manage it well, you can manage it better. So tell us a little bit more in terms of that journey, for the technology and your solution. Where are you now? If I'm a patient and then this sounds amazing, this sounds incredible, I want to know more, I want to get access to this, where are you on that go-to-market strategy and with your own technology journey?
The stage I'm at right now is we are right now building the uh, minimum viable product, the early version of it. So we are going to go direct to consumer first, direct to patients first. The reason why we are going to direct to consumer first is I look at it from the crossing the chasm lens, right? The crossing the chasm lens, there are four types of users: innovator users, early adopters, mainstream and laggers. And for this to work in the scale like we want to, different stakeholders have to come in place. One is the patients, of course, the providers, the payers, and also the farmers and so on. But we are going to direct to consumer first because for the digital solutions like this, if history is our teacher, uh, the providers and the payers and the pharmaceuticals are a bit of a they are not the they are not the innovator or the early adopters. They are usually the mainstream of it. But whereas who are the early innovator user could be patients. So we are going to directly with patients first. To do that, what they can do is they can go to www.gutsphere.com and sign up for the wait list. And we are going to really slowly and expand so that what we really want to do is we really want to help. And we truly also believe that consumers are the co-creators, meaning patients are the co-creators of this. Obviously, the foundation of this is my personal experience, and there may be a lot of overlap among a lot of patients out there, but there also be new things. And we want to co-develop, co-create this platform with the patients. Therefore, we are going to release it. And we are already talking to 5, 10 people. We're getting deep feedback from them and how do I incorporate this and incorporate in this and slowly land and expand on this. That's our strategy right now. Go small, go really powerful and useful. And uh, the detailed point of about how we can be truly a co-pilot, how we can make the conversational very natural and fluent. People understand the context much better, and provide that very personalized experience. And that's where we are at. And I told you about the platform shift, about the generative AI and all. So if you look at the technology landscape, even uh, the let's say the infrastructure for generative AI, the platforms, the tools, the frameworks to develop that kind of application is still very new. Therefore, the challenge is to I say this like taming the large language model is like holding a dragon by this tail and trying to trying to do that. It hallucinates at times. It's like sometimes it's very unpredictable. But again, those are the real challenges of it. But fortunately, our technology. We are great at technology, and we are getting close to launching our private the alpha version very soon.
Very
You know,
cool.
I'd like to just chime in real quick because, I love how this is so patient focused and really it should be, right? It makes a lot of sense, but I can totally see, physicians, doctors, and specialists. I can really see them getting behind this though and really advocating for the technology because kind of to a comment you made earlier, it's only going to make their lives easier too. And you're right. I mean, there's nothing more frustrating than going to a doctor and sitting there and doing this trial by error type thing, or just being like, that was a complete waste of my time, my copay, and now you want me to come back for a follow up and try some things and all that. It's just like, to me, that whole system stinks anyways, because I'm like, I have a life here. Come on, let's figure this out faster. And so, I mean, it's only going to help the doctors give their own patients a better experience.
Yep.
It's only going to help them get better faster. So, I guess where is the app going? Like, how are you launching this today? Like, what are you doing right now to get this in front of patients, building awareness around the app?
Awesome. So Kyle, thanks for asking that question. But before I answer that question, it's really
Yeah,
important to point out another point why I'm going to direct to patient first.
yeah,
You bring a why we are so patient first. When I talk to many people on this healthcare ecosystem, many people say, why don't you go to payers for, providers first? Why don't you payers first? Providers first? And my fear is if you go to this is my fear if you go to the providers first, like all the great intentioned softwares out there, they end up becoming billing softwares. So what I mean by that is, you mean by that is any software. Okay, these are the if the providers do these things, these are the ones that need to be built, and that particular requirements go to product requirement documents. It stops being the patient focused software. It becomes the, okay, how do we design a software in such a way that it's easier for the pay providers to bill rather
Yeah.
than to provide value to the payers. That's
Yeah.
my fear.
Yeah.
Therefore, that's another reason why what really want to I look at from the incentive lens. I want to go to patients first and then provide incentive for them to get better, like cheap, affordable, accessible, and so on.
Yeah.
Then when we go to the key thing is it's important to have this all the other stakeholders as well so that it becomes more effective and adoption is high, but want to make sure that everything we do, the incentive aligned for the patients first. And what are other models that we can work with the payers, providers, and farmers that aligns with the patient's incentive? Otherwise, if you go to patient first, like all great intention
Mhm.
software, the incentives misalignment happens,
Yeah.
and then the mission just derails. So that's my fear. Therefore, I don't want to do that. Therefore, my fear is to go direct to patients first and find an incentive and then work backwards from there.
Yeah, that makes sense. Thanks for sharing that. I think that
Yeah.
clarity is important.
And another part, how do we, therefore, we are going to direct to patient first. And our go-to-market channel is very organic. And if you see like GutSphere, you'll see a GutSphere YouTube channel. We create a lot of content
Yeah.
about the like content, and through that content, what we really want to get is people sign up for it. That's the awareness part of it. And third part is and we are very fortunately, my product management or product background is coming in, and we want to be very product led. What I mean by is adoption is product led, even growth is product led, the retention is product led, which driven by the how the product is giving so much value of it. So we want to for that. But to start the, let's say I would say this, to ignite the fire of distribution or acquisition is all content based. We do YouTube videos, we do newsletters, we do a lot of social media content, and that's how generating a lot of awareness. And to be frank, we don't need millions of users on day one. What we need is small, do start small, be small, provide value to the handful number of people. And
Mhm.
this is the conversation you and my co-founders, my CTO and I have. Hey, we need to start by adding value to one person. Forget the 1 billion, 10 million, 1 million people. One person. That's me. Because I have gone through that. If it adds value to me, then it's going to add value to others as well. Then you can add, then we can start adding value to your mom because
Mhm.
he's passionate about this because his
Mhm.
mom also has this similar problem. Your mom, can we start by doing that? If you can add value to me, your mom, then most likely we cover we value to a lot of people. So it starts with us using it on a daily basis, and that's another beauty of it. I tell you this: if you are the user of your own product and you need it to get better, survive, manage, and
Yeah.
whatsoever, well, it's so much easier to build the product because those features, what next to build, just falls organically. The priority just falls
Yeah.
as organically.
It's interesting because a lot of people, I think, almost from a product development standpoint, you know, they they will do more like data collecting and they'll try to understand, the larger audience. And I find your approach to almost be like, hey, I'm going to start with me. I think that's really interesting. A little inward looking, right? But at the end of the day, this is personalized medicine. This is trying to figure out the problems that you have and how you can solve your problems, right? And then I think that mindset and that strategy of scaling over time, like now let's see who we can help next, and then who can we help next, and give that very personalized, tailor solution to. So, and it's cool to hear that you're doing it through, organic content,
Yep.
video, audio, maybe some events here and there. But, I think it's probably such a large topic and it's so popular to talk about now and for people to research when you're creating content like that. Ultimately, they're going to learn and find out about you. But how do you make money with your company?
Right now, uh, there will be a subscription fees people will pay for the app. That's number
Okay.
one. Uh,
Okay.
so going to pay. Number two is we talk about this curated, the supplements and the curated over-the-counter discovery of it. We want to partner with all the people and provide it cheaper for the patients. That's our
Yeah.
second model.
Yeah.
And third model is when we go to the providers, as I said about the colonoscope preparations, the clinical visit preparations, so we save a ton of money. Like for them, another thing is we provide them real world adherence of it, real world evidence of it. So when you start providing that, I think we expect providers to contribute as well. And third one is like payers as well. As we talk about, the cost for people suffering with GI issue is rapidly expanding, and
Yeah.
it's not talked about because it's not as sexy as to talk about cancer and treating cancer. But again, it's not sexy to talk about people silently suffering through this. But the cost is rising, and because of the volume that cost is used, and we are focused on more very much prevention, self-care, clinical navigation, saving money. I think it'll save a lot of money at them. Farmers, I think payers will pay for this. So definitely, we are thinking about platform, and we are going to start with patients first, patient directly paying for it, and then we also provide this, the curated supplements and so on, which will also at a lower cost than they would find in a market and then providers pay for it. Providers can pay for patients on their behalf, the fixed fee, payers can pay for this. That's how we are thinking, we are approaching. And one thing which I really like to highlight is that we are not trying to substitute the clinical care. We are very clear about that. The what we really want to do is we really want to augment the clinical care and complement them. So that, as I said, right, education part, the data collection part, the navigation part, the preparation part, which those are the parts that we want to do. And more importantly, we want to also provide the holistic one, because right now, as I said earlier, right, this is very multifactorial and factorial. If you go to talk to a GI specialist, most likely they have very little idea about the nutrition. And if you talk about nutrition, they will have idea about it. And as this is very multifactorial, we need multiple people, multiple perspective chime in this thing, and want to make it more holistic. The nutrition approach, the specialist approach, the psychologist approach coming in and even educate on that part. Therefore, what we see is this is a long-winded answer to say payers will and patients will pay first, and then we'll land and expand to other stakeholders as well.
So I'm excited because you mentioned these words, co-creation, co-pilot. Clearly this is something you're doing in partnership with the community. And so for people listening in, you mentioned that people can come onto your platform, they can sign up, if they're interested in getting involved. Clearly there's probably going to take some investment to get you to that next stage. So if people want to get in touch, what's that best way to reach out to you?
So best way to reach out to is multiple ways. Number one, I say is my email. So I'm upon my bimal@gutsphere.com. That's number one. And number two is if you want to sign up for the our Copilot waitlist, go to www.gutsphere.com and sign up for it. A cool thing is you also get, when you sign up for that, you also get a guided journal to track, which you can print. A guided journal, you'll get that for free. That's second. And third thing is we are available at GutSphere in all the social platforms. So you can send a message and you can subscribe and so on. And that's how we can engage it. And also particularly when people sign up, we send an email to you and we have a conversation with them to understand their experience, like to show them our prototype, and they give the feedback. As I said, right, patients are the co-creators of it, and we want to truly become the co-pilot. And if anything else, one thing I would say is to all the patients, all the people who are suffering with GI issues and diseases out there, one thing I would say is if you forget about all the tools, everything out there, just be the pilot of your own health. Be a little bit proactive, little bit read more, right? Think about what works for you, what doesn't work for you. Nobody lives in your body but you for 24/7. Nobody suffers for you but you 24/7. And nobody else will smile for you but you when you get rid of all the discomforts, all the symptoms, and you truly change your life. You will be the one who's smiling the most for you. So be that pilot, and you deserve it. That's what I want to say. One thing.
Brilliant. Absolutely. Well, what a way to finish this conversation. And I think for anyone tuning in who is caring about their gut health, this is inspiring, this is informative, and I'm sure people will be wanting to reach out. So thank you, Bimal.
Thank you so much, Richard, and thank you so much, Kyle, for this opportunity. I really enjoyed it. I'm glad that you invited me.
Absolutely. Well, it's a pleasure. And remember, you're gonna have to hit up Austin Zhang there for from Medtronic, who put out this gut health book. I can see you guys collaborating on a fantastic podcast, further educating all patients out there that are struggling with GI related challenges. So, well, ladies and gentlemen, another huge thank you to Bimal Maharjan, founder and CEO of GutSphere. And thank you for tuning into another episode of the MedTech Impact Podcast. I'm Kyle Cruz.
And I'm Richard Meiklejohn. Until next time, keep innovating.